Hello everyone, my name is Dr. Soto. I am a physician. I specialize in internal medicine and I've had the honor of taking care of the people of Arizona for 16 years. In discussing one of the new props that's up for a vote this election cycle, I found that there are a lot of people very confused about this prop. I'm talking about Prop 139. Even medical people are confused, and that's because you would almost have to have a legal degree and a medical degree to understand this thing and all of the nuances. So I decided to make a video and kind of put some of my thoughts down. Hopefully it clarifies everything. I'm taking everything directly out of the voter guide that every single household got. So feel free to follow along with me. Okay, there's a lot to go through, and I think it's appropriate that I'm actually taping this on Halloween because some of the things we're going to talk about are truly terrifying. The reason I wanted to talk about this is because the language that is used in this prop is so exceedingly vague that I believe that it will cause great harm to Arizonans. And actually every physician that I've talked to also has some great concerns that are not being addressed. Hopefully this video provides clarity and can get the discussion going about this issue. So with that, let's go to point number one. The language in this prop says, every individual has a fundamental right to abortion. So that choice of words individual is very interesting. The law as it stands right now, if you're a minor getting an abortion, you have to have parental consent. By changing it to individual, not woman, then the law would allow for a teenager to have an abortion without parental consent. The concern for a lot of people, including myself, is that if a young girl is being abused, trafficked, molested, and they've been groomed, they will sign that they're not being coerced in any way. There's nobody that needs to provide parental consent, and this will open a loophole for traffickers and abusers to keep doing those horrible things that they're doing. So I think the language in this prop, just in the first line, is dangerous. Denies, restricts, or interferes with an abortion after fetal viability that, in the good faith judgment of a treating healthcare professional, is necessary to protect the life or physical and mental health of the pregnant individual. There's so much in this line. But let me just take that one term, healthcare professional, we need to really look at, because this one term scares the crap out of every physician that I've talked to about this. Most people don't realize healthcare professional doesn't mean physician. Under HB 2036, the Mother's Health and Safety Act, it is required that any physician be on site for surgical abortions and have admitting privileges at a hospital within 30 miles of the abortion clinic in case there's a complication. The wording in this prop saying healthcare professional, not physician, is what is really scary, because under Arizona law 32-3201, a healthcare professional includes naturopaths, nurse practitioners, physician assistants, podiatrists, chiropractors, dentists, pharmacists. This is nuts, you guys. I mean, all of these providers have a place in healthcare, and I've actually used much of their services. I've had acupuncture. It was fantastic for my headache. Don't really want an acupuncturist taking out my tooth, and I don't really want my dentist doing my pap smear. I mean, this is nuts. And the problem specific to Arizona is that the naturopathic doctors, yes, they're doctors, which confuses people, they do not have a very defined scope of practice. So the law here allows them to do minor procedures. But this is the problem when things in the law are vague and undefined. They're doing plastic surgery as a minor procedure. And I'm not talking about just a little nip and a tuck. Full body lipo, BBLs, things that are some of the most dangerous cosmetic procedures that a person can have. And many of my colleagues, as well as myself, you ask any ER doctor in the Valley, we have seen the complications of doctors being allowed to do things that they are not really qualified to do because the law is undefined. Their scope of practice is undefined. Actually, California is doing a much better job than us. They have defined exactly how many layers of skin a naturopath is allowed to traverse in any procedure that they make. We have not done this. So we have had people come to some serious harm. Have one of my patients personally showed up at the hospital in a hypertensive crisis. We had to put her on dialysis, and she was Spanish speaking, and so I'm able to speak with her in my native tongue of Spanish. And she was absolutely shocked and horrified when I explained to her that the doctor that had done her procedure was not a plastic surgeon. She thought she was putting her life in the hands of a physician, because they call themselves doctors, they wear white coats, they can prescribe medications. We are one of, I think, only 8 states that allow naturopaths to prescribe narcotics. And now we let them do minor surgeries. And now this prop would allow them to do abortions. And they are not OBGYNs. And they do not have admitting privileges anywhere. So when they make a mistake, the same thing is going to happen with abortions as is happening now with plastic surgeries. They're going to send the patient to the ER for my ER colleagues and myself and my OBGYN colleagues to then fix what they've done, hopefully in time. But it terrifies me to think of the complications that Arizonans, especially young girls, would go through because the law is so vague. We've actually had people die because of complications of plastic surgery done by naturopaths that were not adhering to basic practice standards, and the state doesn't intervene as quickly as we would all like. So I would urge you, just with that line alone, vote no for Prop 139. It is extremely vague and extremely dangerous. It's not like other states that have expanded the scope to include PAs and nurse practitioners. It is very clearly stated in those states' laws that the NP and the PA have to be under the supervision of a physician. They can only perform first trimester abortions. It is very specific. I don't see anything in this prop that gives us that kind of clarity. So that alone scares a lot of physicians. Oh, another thing I forgot. Arizona has a little loophole where it is possible for other physicians in other states who've lost their license for some reason to then come to Arizona and practice under a naturopathic license. Now, you're supposed to be in good standing in other states in order for that to apply. But the Naturopathic Board does not seem to be applying that all of the time. So we do actually have some naturopathic doctors who used to be allopathic or osteopathic doctors who've done something in other states that made them lose their license. And now they're here in Arizona and free to take patients' lives into their hands. Pretty scary, isn't it? Another point. In speaking with my veterinary colleagues, if an animal has to have an abortion, it has to be a vet. If a human needs an abortion under Prop 139, well, we'll talk about this later, it can be a late-term abortion and doesn't actually have to be done by a doctor. Scary as that. We can do better, Arizona. Let's go to the rest of that line. Oh, okay, skip with me to Part A, right here at the top, okay? After it says every individual has a fundamental right to abortion, and the state shall not enact, adopt, or enforce any law, regulation, policy, or practice that does any of the following: denies, restricts, or interferes with that right before fetal viability unless justified by compelling state interest that is achieved in the least restrictive means. So here's the thing. I don't think people realize how restrictive healthcare really is for patient safety. I mean, the hospitals are actually restricted even as far as to how many hours they can keep somebody in a room without windows. JCO, the Joint Commission, the state, in fact, can come in and they check everything down to where the exits are, how many exits, how we keep our medications, how they're labeled, are we using expired medications, how we keep the medications stored in a code card. They regulate everything because it is so important, because people's lives are at risk. There is no clinic, there is no rehab center, there is no, even the minute clinic at the pharmacy is very strictly regulated. It's not the government getting into our business, but the sad reality of it is that even things that are common sense, even things that are standard of care, will not be done if there is not an enforceable way to make sure that those things are done. So the state comes in and they regulate every clinic to make sure that they are staying in accordance with the law. This is basically a get out of jail free card for one particular type of clinic, and they will be the only ones that have that kind of leeway. I see a lot of room for cutting corners, for standards to not be enforced, and that is really going to be dangerous for Arizonans. I have read the entire 24-page HB 2036. Let me get the numbers right. It outlines the safety measures that abortion clinics have to adhere to under the law. It's really basic stuff, you guys. I mean, like basic safety standards for cleanliness, for labeling things, for how you take an exam, how patients are going to be monitored after a procedure. If it was automatically done, if it were common sense and just standard of care, the law wouldn't have to state it specifically. But the truth is that any practice, abortion clinics, dialysis centers, your primary care doctor, any practice would intentionally or unintentionally cut corners if there weren't very clearly defined standards that were enforceable by the state. Very strict standards that are enforced by the state. A clinic could decide, oh, it's too expensive to have this type of person or to have this type of machine, even though it's for patient safety, and then just cut it and come up with their own way of achieving what they think is the same. For example, abortion clinics have pushed really, really hard to not be required to be ambulatory surgical centers. They say abortions are really safe. It doesn't add any safety benefit. For those that don't understand what an ambulatory surgical center is, they are very, very high standards of cleanliness and safety so that procedures, even minor complex procedures, can be done in a safe way. The argument could be made that it doesn't add any added safety for first trimester abortions, or even up to maybe 13, 14, 15 weeks. But this prop, as we'll see later, will allow for abortions up until 40 weeks. And now there's going to be no standard for regulating how these clinics are going to operate. Are they going to require a sterilization technician? That is one point, but I think a very easy one to understand. A sterilization tech is somebody whose sole job is to make sure that all the instruments are clean. I have a degree in microbiology, and let me tell you, those little suckers can get in anywhere. You can have one bacteria cross-contaminate something and now somebody gets sick. So these people study, and their whole job is to make sure things are not just clean, sterile. And they make about $55,000 a year. So for a clinic to have to employ one is really expensive, but it is what is safer for the patients, especially if we're going to be expanding that from 15 weeks all the way to 40 weeks, when it's about 20 times more dangerous to do an abortion than it is before 8 weeks. We need those levels of safety. And this prop would allow clinics to basically operate in any way they see fit, and they would be the only thing in healthcare that gets away with that. Let's talk about that term, accepted clinical standards of practice in evidence-based medicine. The funny thing is, if you ask 5 different doctors, you're going to get 5 different opinions. There is no one accepted clinical standard for anything. take colonoscopies in my branch of medicine, internal medicine. My colleagues have come up with a set. The ACP has just published a set of guidelines. If you ask the gastroenterologists, they've come up with a slightly more aggressive set of guidelines. Then the U.S. Preventive Service Task Force has their guidelines, and the colorectal surgeons have their guidelines. They're very similar, but they're not exactly the same. So when they're talking accepted clinical standards and evidence-based medicine, what accepted clinical standards? Are we going by the College of Obstetrics and Gynecology standards? If so, it needs to be very specifically stated, or this will leave room for every Tom, Dick, and Harry to go out there and develop their own accepted set of standards, and naturopaths could come up with their own set of standards. And who's going to enforce any sort of safety restrictions when by law it has to be done in the least restrictive means possible? That's just not safe for patients. We can do better, Arizona. Something interesting that's happened since COVID, for the abortion pills, there is, or was, an in-person requirement. So women, in order to get an abortion pill, had to have an exam and an ultrasound in person before they got an abortion pill. And the FDA still mandates that women be ruled out for an ectopic pregnancy. And that was the reason for the in-person exam and ultrasound, because an ectopic pregnancy is when the pregnancy happens not inside the uterus, but in the tubes just outside. So as the baby grows, it can rupture, and basically the woman bleeds internally. It is the most deadly thing that can happen in the first trimester. So COVID happened, and there was restricted access to, in-person appointments were restricted all around. So ACOG pushed back, and the FDA removed the in-person requirement. So if you read it in the law, it still says the FDA requires a practitioner to rule out an ectopic pregnancy, but then they're not going to say how that is done. So now we have about 10% of abortions that are being done with abortion pills through a telehealth visit, or not in person. And as somebody that's actually dealt with the repercussions of an ectopic pregnancy, I know how tricky those can be to rule out. I've seen even OBGYNs miss those, even with an ultrasound. And these people are being allowed by the FDA, because of the least restrictive means possible is the goal, not patient safety. They are allowed to guess psychically through a screen whether a woman has an ectopic pregnancy. And the problem with that is they can make a study say anything. There was a study then out of UC San Francisco where they gave abortion pills to 585 women. One group was no in-person visit. One was in person, but they didn't do the ultrasound, and another ultrasound and exam as well. And none of them had complications. The problem is that ectopic pregnancy is only about 1% of pregnancies. So 1 to 2%. So they had a 98% chance at least of picking women for this study that were not going to have an ectopic pregnancy, and they're going to do just fine. Wonderful. But if you're that 1 to 2%, that's a death sentence that they're not even bothering to rule out. And I'm sorry, but if it was my sister, my daughter, my friend, my wife, I wouldn't care what some study from San Francisco said. All I would care about is that you could have ruled out something potentially deadly with something as easy as an ultrasound, and they just didn't. So just because something is evidence-based and standard of care, it does not mean it's going to happen. It is not going to be enforced. It's unenforceable. So this prop would allow for even more loopholes for providers to not adhere to the actual standards or just common sense. Okay, so we have a guideline ruling out an ectopic pregnancy with a basic ultrasound, something that is safe, it's cheap, easy to do, it is evidence-based, it's in the guidelines, it is mandated by the FDA, not being done. At least 10% of abortions are done with pills without following the guidelines. If we let this Least restrictive means into the Constitution. It's basically a blank check for only one clinic, one type of service in healthcare to make up their own rules. And no other part of healthcare gets that kind of a blank check. They will make up their own guidelines. If they don't like a rule, they'll say it's too restrictive, and patients will pay the price. Let's talk about this section where it says, it's number 3, and penalizes any individual or entity for aiding or assisting a pregnant individual in exercising the individual's right to abortion as provided in this section. Basically, this is a Christmas gift to the cartels, let me tell you. This is their Christmas gift in this proposition, because we already saw, number 1, we're not going to be requiring parental consent. Number 2, now they cannot be prosecuted for helping, forcing a girl to get an abortion. So they'll be immune. They'll drop the girl off or do it through a telehealth visit, force the girl to get an abortion, and they cannot be prosecuted. It's a little Christmas gift for the cartels in this prop right there. What people don't realize, and in my research, this was actually a surprise, a very sad one. Shared Hope International, which is an advocacy group for victims of human trafficking, has given Arizona a big fat F for how we support victims of human trafficking. I'll put the link down below. People can go read our report card. Basically, our legislation doesn't protect the victims of human trafficking, and now we're going to put something in a prop in the Constitution that enables those that are making the victims be in a horrible position. We're helping the bad guys, basically, instead of the victims. We're removing the in-person requirement. We're removing the parental consent. And now they can't be prosecuted for helping the girl get an abortion. So they can keep abusing her and selling her. And this is horrendous. We shouldn't have these loopholes. This is so poorly written that will absolutely be an unintended consequence. And once it's in the Constitution, forget about it. Impossible to correct. We need to close a lot of loopholes before we put anything like this in the Constitution. Okay, let's move on to one of the 2 most contentious things about this. Read with me where it says 8.1A1 denies, restricts, or interferes with that right before fetal viability unless justified by compelling state interest. So if you move all the way down to Part B, number 2, way down at the bottom, they're redefining what viability is. So in medicine, viability means the baby could survive outside of the womb, whether that's using incubators, feeding tubes, breathing tubes, whatever, but the baby has a chance. They are redefining, and this is what they have sort of tacked onto the bottom, and they're hoping people won't actually read. Fetal viability means the point in pregnancy when in the good faith judgment, that's important because they're not requiring that anybody be particularly qualified in judging neonatal medicine and when a baby's able to survive. It's just a good faith judgment. It's basically like a really good guess. Basically, in the really good guess of the treating healthcare professional, in other words, naturopath, acupuncturist, whoever, and based on that particular facts of the case, there's a significant likelihood the fetus sustains survival outside the uterus without the application of extraordinary medical measures. So basically, they are redefining what viability is. Right now, it's 24 weeks, more or less. But then they haven't really defined what extraordinary measures means. Does it mean incubators, feeding tubes, breathing tubes, all of the above? Only one? They don't say. They leave it up to interpretation. It's vague enough that it could mean anything. In the good faith judgment of every Tom, Dick, and Harry that decides they can do an abortion, they can decide, oh, this baby probably wouldn't survive without a feeding tube. And here's what most people would not be expected to know. babies don't coordinate their breathing and sucking and swallowing until 34 to 36 weeks. So they could potentially need a feeding tube until 36 weeks. So in the good faith guess of the person that has a financial interest in performing the abortion, they can say, this baby wouldn't survive at 34 weeks, 35 weeks. They would probably need a feeding tube. So it justifies the abortion because it's not viable. In their new legal definition, it's very important for people to realize the legal definition they're trying to push is not a medical definition. Two totally different things. Okay? And I think if that is what people in Arizona want, they should know that that is what they're voting for. But otherwise, it's very sneakily tacked onto the bottom. Here's something that bothers me about moving viability down a notch. The way the law stands at 15 weeks is a very deliberate marker. Not only is it for safety, because if you take the risk of mortality before 8 weeks, after 12 weeks, it jumps up 5 times. And then after 18 weeks, it is at least 10 times more dangerous to do an abortion than it was before 8 weeks. Okay, so 15 weeks is a pretty good marker that was chosen for safety reasons, but also we can tell the sex of a baby at about 18 weeks. This prohibits, this cap for any reason, the 15-week cap for any reason, prohibits anybody from going to get an abortion because they wanted a boy instead of a girl, for example. A husband can't say, oh no, I didn't want you to have a girl, I want to have a boy, so go kill the baby. They can't do that. That kind of sexual discrimination is not allowed anywhere in jobs, in employments, in the government, in schools. The only place that would conceivably be legal is in the mother's womb. Here's another point of contention. Part A, number 2, denies, restricts, or interferes with an abortion after fetal viability, that in the good faith judgment, best guess, of the treating healthcare professional, naturopath, acupuncturist, whatever, is necessary to protect the life or physical or mental health of the pregnant individual. And here's my issue with that. They're, again, not defining what mental health means. Does that mean somebody is suicidal? Does that mean somebody's mental state is so fragile that they cannot be pregnant? In which case, that should probably be determined by a psychiatrist. But they are leaving it up to the good faith judgment, guess, of the healthcare professional, naturopath, acupuncturist, whoever, who has a financial interest in performing the procedure, which, first of all, huge conflict of interest there. And they get to decide if this is going to affect the mental health of the individual without defining what mental health means. Are they suicidal? Are they schizophrenic? Are they just angry, depressed? What? So theoretically, a woman could break up with her boyfriend a week from her due date and go to a naturopath and say, I'm so depressed because I broke up with my boyfriend, I don't want to have his baby anymore. And it would completely justify a late-term abortion in Arizona, not even performed by an actual doctor. How's that for a scary story for you, Arizona? I'm sorry, but I think we can do better. And if late-term abortions is what Arizonans want, I think transparency is the key. I think Arizonans need to know that that is what they're voting for in this prop. But just from the vagueness of the language, I think we can do better. I think the women of Arizona can do better. Even if you are pro-choice, this prop is not the way to go. It is so incredibly vague that it opens up all kinds of loopholes. There's more holes in this than a fishnet, okay? It will make Arizonan women and girls be in a situation where their life could be at risk, and it could have been prevented with some simple measures of clearing up the language, setting some guidelines. This is not acceptable in my mind. I have sworn to serve the people of Arizona that I love, so I had to speak up. And every physician that I've spoken to, including many that have signed the proposition on Arizona's Physicians Against Prop 139, we all agree this is incredibly scary for our patients. So even if you're pro-choice, please vote no for this thing. It is way too vague. It leaves way too many loopholes that need to be closed first. Let's keep the women and girls of Arizona safe. Okay, thank you. Love you, Arizona.